Hi, this is Dr. Nick with the ECG Academy, and we're starting a new section now on atrial flutter. Now, atrial flutter is not as common as some of the other atrial tachyarrhythmias that we'll see. We've already covered supraventricular tachycardia or atrial tachycardias. And you can see atrial flutter maybe accounts for about 1/4 of the atrial arrhythmias you might see in an emergency room. And it's a very specific kind of arrhythmia that's caused by rapid signals originating in the top chamber. So imagine you've got this electrical signal that's going around and around in the top chamber. And you say, well, that's a lot like atrial tachycardia. The difference is the rate. In atrial flutter, what you expect to see are rates in the range of maybe 225 to about 350 beats per minute. So if you see heart rates in that range, then you can correctly classify it as atrial flutter. Now, there are different kinds of atrial flutter, which we'll talk about in the advanced course, and the differences have to do with where this atrial flutter is coming from. If it's coming from the right side of the heart or the left side of the heart, it'll give you a different appearance on the electrocardiogram. But for the sake of this basic course, I want you to understand that anytime you see atrial rates in this range, we're talking about atrial flutter. But there's one thing that sets atrial flutter apart from other arrhythmias like atrial fibrillation, and that flutter is an organized arrhythmia. That means that all the beats look the same. If you look at this animation that I created to show you what atrial flutter looks like in action, you can see that here in the right atrium, I've essentially created what looks like an electrical signal traveling round and round in a circle. But you can see every time it goes around, it takes the same pathway. It may cross through Bachmann's bundle to the left side as well. And of course, the AV node is going to conduct as many impulses as it can to the ventricles, depending upon what kind of shape the AV node is in. But the point is the signal is going round and round in a circle. Now, sometimes atrial flutters can come from a focal source, and we'll talk about that in a later lesson. But because the atrial signal is consistently going around in a circle or consistently arising from one spot in the atrium, what you see is characteristically a sawtooth pattern of electrical activity in the atrium during atrial flutter. Now, sometimes it's a nice-looking cross-cut. I like to call it the Black and Decker syndrome. How many people are going to get that joke? But sometimes you'll see different kinds of sawtooth patterns. The point is that during atrial flutter, the atrial signals always look the same. On occasion, you'll see more of a sinusoidal rhythm, and what you're really looking for is a heart rate somewhere in the range of about 225 or 250 to 350. So that's how you're going to make the diagnosis of atrial flutter. Of course, you'll see QRS complexes in this rhythm every now and then, depending upon how rapidly the AV node is conducting. Well, let's show you a couple of examples. This is an example of a rhythm strip in a patient who has atrial flutter. And in this case, at least, you can believe what's written on the strip. I vouch for it this time. But what you see is when you look at the forest, in this case, you have irregular QRS complexes. And if you measure the rate as 300, 150, 175, so right about 75 beats per minute, and it's really quite regular. And then when you look for P waves, what you see in between the QRS complexes is this very clear sawtooth pattern. And if you ignore the QRS complexes, you'll see that that sawtooth pattern marches on through. It's very consistent, and in this case, pretty unmistakable. Now, following the QRS complex, you see that this downgoing sawtooth wave doesn't go down as far as the rest of them. You see how deep these are? And this is very, very deep. And then right following the QRS, it's not so deep. Why do you think that is? Well, it's because the QRS has a positive going T wave, and when you get the positive upgoing T wave and the downgoing deep flutter wave, when they sort of mush together, the sum of those two signals is a lot flatter than either one alone because they're going in opposite directions. So that explains why you see how this T wave is going to depress the depth of the flutter wave, and that explains why you have to be careful because you don't always see the flutter waves as clearly as you do in this strip. In fact, sometimes you have to look for them. So here's a great strip, and when you look at the forest, you see that it is very irregular here. You've got a few very long intervals and an even longer one, and then you've got a bunch of short intervals, and it seems to be irregular but without any pattern to it. Most of the QRS complexes are very narrow, but you do have one wide beat here. So now when you start to look in between the QRS complexes, you are looking for P waves of some sort, something that you can hang your hat on. And you see a bunch of junk in here, and you don't see a discrete P wave necessarily, although you're starting to see little sort of negative deflections here, and you wonder, could that be a P? And then in the front of this beat, there's a kind of a negative deflection here, and then in front of here, there's a negative deflection. But when the baseline kind of settles down, and you look in between these long R to R intervals, you should be able to start to recognize that there's this repeating pattern. There are these down-going squiggles that actually represent the flutter waves. People refer to these as F waves instead of P waves. And in this case, they don't have a nice gradual up and down sawtooth pattern, but rather they're more flat, and then you get a sharp downward and a little overshoot, and then another flat area, and then a sharp down signal, an overshoot, and then another flat area. So this is just a different appearance to the flutter waves. But let's say if we blow this image up a little bit, and we take a pair of calipers and put the calipers down on these flutter waves, you can see that they do map out very nicely. And there's somewhere, if you put the caliper down, somewhere at a little bit less than 300 beats per minute, about maybe 275 or 280 beats per minute. The cycle length of the atrial flutter is about 220 milliseconds. You get 272, so that's pretty close. Well, anyway, getting back to this strip, what you see are these flutter waves indeed marching through at a steady rate. The AV node occasionally passes every other impulse down, so that you get ventricular rates in the range of about 140 beats per minute, which is roughly 1/2 of the atrial rate. And so in this region right here, you have basically 2 flutter waves for every QRS complex. And we refer to this as atrial flutter with 2-to-1 conduction. I'm going to spend more time with 2-to-1 flutter in the next lesson. But in this case, I want you to notice that at times this AV node breaks up. Remember, the AV node determines what the ventricular rate is going to be. And so sometimes you'll get more block in the AV node and less impulses will get to the ventricles. So in this case, you have 1, 2, 3, 4 flutter waves in between these 2 QRS complexes. So this is 4-to-1 flutter, as is this. So you can get a sense of how well the AV node is conducting by the ventricular rate, which is a function of how many flutter waves are actually getting through the AV node. The key to recognizing atrial flutter is that you have to look for it. It's very important to try to nail down what the atrial rate is, and notice that every flutter wave looks the same. Even though there may be some variations because of superimposed T waves, for the most part, every flutter wave is looking the same. And that just verifies that what you have is an electrical signal that it's either going round and round the same pathway each and every time, or less often you may have one fixed focus that's firing at a rapid rate, and the signals are spreading across the atria in a very organized fashion every single time. So with this introduction to atrial flutter, go on to the next video, and we'll discuss 2-to-1 flutter and how it can often masquerade and be difficult to diagnose unless you're looking for it. So for the ECG Academy, this is Dr. Nick. Thanks for watching.